Welcome back to our channel. I'm here today to share some valuable insights on a topic that's close to my heart. With over a decade of experience as a professional pharmacist, I've had the privilege of consulting with thousands of clients in drugstores, assisting them in finding the best natural approaches to lower blood pressure. Today, I'm excited to share that knowledge and experience with all of you. So, let's dive right in. High blood pressure, also known as hypertension, occurs when the force of blood against your artery walls remains consistently too high. It presents in two stages. Stage 1 manifests when the top number ranges from 130 to 139 millimeters of mercury, or the bottom number is between 80 and 89 millimeters of mercury. Stage 2 occurs when the top number is 140 millimeters of mercury or higher, or the bottom number is 90 millimeters of mercury or higher. This persistent pressure can result in significant damage over time. Now, let's delve into the potentially devastating consequences of high blood pressure. Consider high blood pressure as a silent saboteur, gradually damaging the cells of the artery's inner lining, known as the endothelium. This leads to the accumulation of fats, specifically LDL cholesterol, and white blood cells, which are your body's first responders to injuries and inflammation. These collect in the damaged areas of the arteries, reducing their flexibility and increasing the risk of plaque buildup, which ultimately leads to atherosclerosis. This, in turn, elevates your chances of developing heart disease, strokes, and a range of other health issues. Your kidneys, and even your eyes, can also suffer the consequences. Notably, many men experience erectile dysfunction due to reduced blood flow to the pelvic area, caused by artery stiffening. So, why is it paramount to control your blood pressure? The answer lies in improving not only the length, but also the quality of your life. A study conducted at Brigham and Women's Hospital indicates that lowering blood pressure to normal levels can add up to 3 years to a person's lifetime. This study was published in JAMA Cardiology. Yet, managing your blood pressure isn't just about adding years to your life, it's about adding life to your years. By doing so, you can significantly reduce the risk of heart disease, strokes, and a myriad of other life-altering health issues. Normal blood pressure will preserve the functions of your entire body and organs for years. Now that we've grasped the gravity of the situation, let's move on to the 12 natural tips that can be game changers. Tip number 1. Garlic supplements. Garlic is a natural wonder when it comes to lowering blood pressure. The active compound allicin can prevent angiotensin production, a hormone responsible for raising blood pressure. This, in turn, helps relax your blood vessels, promoting smoother blood flow. Many studies and trials have confirmed the effectiveness of garlic and garlic supplements at lowering high blood pressure. For instance, a study published in the renowned scientific journal Elsevier shows that garlic can not only lower blood pressure, but also regulate serum cholesterol and stimulate immunity. Moreover, garlic has prebiotic properties and increases gut microbial richness and diversity. Garlic supplements are usually in the form of powder and tablets or soft gels containing concentrated garlic oil. A typical dose for the powder and tablet form ranges from 600 to 1,200 milligrams per day, while the concentrated oil form typically ranges from 1 to 2 milligrams of garlic oil. Tip number 2. Fasting. Intermittent fasting, which involves cycling between periods of eating and fasting, has gained recognition for its potential to aid in weight loss and improve insulin sensitivity. There are several fasting approaches, such as the 16-8 method, where you abstain from eating for 16 consecutive hours and eat during the remaining 8. Other good approaches include OMAD, 1 meal a day, and alternate day fasting, during which you eat every other day. Many studies have shown the multiple benefits of intermittent fasting, including its potential to lower blood pressure naturally. Fasting can help reduce blood pressure through several mechanisms. 1. Weight loss. Shedding excess weight is a proven method to reduce blood pressure, particularly in obese individuals, as it reduces the strain on the heart and promotes healthier arteries. 2. Relaxation. Fasting activates parasympathetic pathways, inducing a state of relaxation in the body, contrasting with the sympathetic pathway, associated with heightened alertness and increased blood pressure. 3. Low stomach volume. An empty stomach has a smaller volume, reducing the physical pressure it exerts on the heart, particularly in individuals with visceral fat. 4. Autophagy. Fasting stimulates repair and autophagy processes in the body, including in the heart and arteries. This is achieved primarily by the suppression of the mTOR enzyme, which inhibits autophagy. Fasting promotes mTOR inhibition, enhancing the body's self-repair mechanisms. 5. Lowers cholesterol. High cholesterol is associated with narrowed blood vessels and atherosclerosis, both of which result in high blood pressure. Fasting has been shown to lower cholesterol significantly. Tip number 3. L-Arginine Supplements. L-Arginine is an amino acid that plays a pivotal role in nitric oxide production. In the body, L-Arginine is converted into nitric oxide. Nitric oxide causes blood vessels to open wider, improving blood flow. Usually, our body produces and obtains all the L-Arginine it needs from food. However, as we age, or due to damage to the endothelium, the inner layer of cells in the arteries, where L-Arginine is converted to nitric oxide, the concentration of this key chemical for maintaining healthy blood pressure decreases. That's why supplementing with L-Arginine can be a great way to lower your blood pressure. It also helps men with erectile dysfunction, which occurs as a side effect of taking medications for high blood pressure. L-Arginine supplements typically come in tablet form. A typical dose is around 2 to 3 grams per day. However, I would recommend starting with a higher dose, approximately 6 grams per day, split throughout the day. The idea is to replenish your body with L-Arginine and boost nitric oxide production. Of course, you should closely monitor your blood pressure during this initial stage to prevent sudden and significant drops in blood pressure. After a week or two, you can reduce the dose to the normal 3 grams per day. It's worth mentioning that some studies suggest possible mTOR activation from arginine, so it may be advisable to consume arginine during the eating state. Tip number 4. Regular exercise, with a focus on walking. Physical activity is like a workout for your heart and blood vessels. By engaging in regular exercises, your heart becomes stronger, allowing it to pump blood with less effort, reducing the pressure on the arteries. Additionally, exercises, particularly aerobic ones like walking and cycling, stimulate blood flow throughout the body, improving oxygen transport to the cells and delivering vital elements for cellular functions, such as amino acids and vitamins. Increased blood flow also helps prevent blood stagnation in the veins, which is a significant issue for varicose veins and blood clots. Some studies suggest that exercise relaxes the body, which has a positive effect on blood pressure. Aim for at least 150 minutes of moderate exercise per week, and don't underestimate the power of a brisk daily walk. Tip number 5. Losing weight. Numerous studies have shown that losing weight significantly lowers blood pressure, especially in obese individuals. There are several reasons for this. The heart has to work harder in obese individuals to deliver blood throughout the body due to excess weight. Abnormal weight is associated with increased levels of cholesterol and inflammation, which lead to artery thickening, reduced blood flow, and decreased arterial flexibility. The inner layer of the arteries, known as the endothelium, is damaged in obese individuals, reducing nitric oxide production. Nitric oxide is a natural arterial dilator that opens up the arteries, lowering blood pressure and promoting blood flow. This decrease in nitric oxide production is also linked to erectile dysfunction. Combine regular exercise with a balanced diet rich in whole foods to aid in weight loss and better blood pressure control. Try to avoid simple sugars and opt for foods high in fiber.
Tip number 6. Common hawthorn supplements. Hawthorn is one of the most popular herbs in folk medicine in both Europe and China.
It has been used for centuries to treat cardiovascular diseases, high blood pressure, and atherosclerosis.
Many studies have found that the plant is rich in flavonoids, oligomeric proanthocyanidins, and other antioxidants.
It acts as a potent antioxidant and vasodilator by inducing nitric oxide production in the endothelium. Additionally, the pectin in fresh hawthorn fruit was reported to be as high as 20.5%.
Pectin, as we know, has significant cholesterol-lowering properties.
Lowering cholesterol helps reduce and prevent artery atherosclerosis, leading to improved blood flow and reduced blood pressure. Hawthorn has several species, but the most effective and widely used in medicine is Crataegus monogyna. You can incorporate hawthorn berries into your diet, such as by adding them to yogurt or taking them as a supplement.
The recommended dose is between 600 to 900 milligrams daily. Tip number 7. Magnesium and potassium supplements. These essential minerals play a crucial role in regulating blood pressure. Magnesium acts as a natural calcium channel blocker, which reduces the influx of calcium into cells, resulting in less cell contraction.
This in turn lowers the heart's workload and helps reduce blood pressure. Potassium is essential for kidney function, as it aids in sodium excretion, which reduces water retention and blood volume, ultimately decreasing blood pressure. The typical daily dose for magnesium is between 500 to 1000 milligrams. Taking it in the evening can help reduce the risk of muscle cramps as well. For potassium, the daily dose is around 2000 milligrams for women and 3000 milligrams for men. Both minerals can be found in foods and in tablet form.
Consider obtaining potassium from foods like bananas, avocados, beans, and spinach. Tip number 8. Lowering LDL cholesterol levels.
Elevated levels of LDL cholesterol can lead to artery plaque and atherosclerosis, which raises blood pressure. Reducing high LDL levels is essential for managing high blood pressure. Try incorporating multiple approaches in lowering your LDL levels, such as low-carb diet, eating more whole foods and fibers, supplements for lowering cholesterol, fasting, and regular exercises. To learn more about natural approaches to reducing cholesterol, I highly recommend watching my video on the 5 natural tips to reduce cholesterol.
Tip number 9. Reducing stress. We live in a society filled with stress from various sources, including never-ending work tasks and the hustle and bustle of city life. Chronic stress can significantly impact blood pressure by triggering hormonal responses that lead to elevated levels. Cortisol, the stress hormone, is responsible for raising our blood pressure.
While it serves a beneficial role in small doses, such as providing an initial morning boost, chronic exposure to stressors keeps cortisol levels elevated throughout the day, resulting in constant high blood pressure. There are various approaches to deal with chronic stress, and it may differ from person to person.
Identifying the sources of your stress and minimizing or eliminating them is crucial.
Consider incorporating relaxation techniques like meditation, yoga, or deep breathing exercises into your daily routine.
You can also take a 5-HTP supplement, which is serotonin, the feel-good hormone.
It relaxes the nervous system, inducing a state of calmness.
The typical 5-HTP dose is 500 milligrams, taken 2 to 3 times a day. For maximum absorption, consider taking it in combination with vitamin B6 and magnesium. Tip number 10. Reducing salt intake.
Excess sodium can lead to water retention, contributing to elevated blood pressure levels. Most of the foods we consume already contain sufficient salt, so additional salt in our meals is generally unnecessary.
Tip number 11.
Reducing alcohol consumption. Alcohol is consumed by around 2 billion people worldwide, but excessive alcohol intake can elevate blood pressure, especially when it becomes a regular habit.
There are several hypotheses explaining how alcohol increases blood pressure. One popular theory suggests that acute alcohol consumption affects the renin-angiotensin-aldosterone system by increasing plasma renin activity. Renin is an enzyme responsible for the production of angiotensin 1. Angiotensin 1 is then converted to angiotensin 2 by the angiotensin converting enzyme. Angiotensin 2 is a hormone that acts as a vasoconstrictor.
It also stimulates the secretion of aldosterone and vasopressin from the adrenal gland, promoting sodium and water retention. This leads to increased peripheral resistance and blood volume, resulting in elevated arterial blood pressure. Reducing alcohol consumption or eliminating it altogether can be a challenging task, particularly for heavy drinkers. Alcohol is an addictive substance, and successfully quitting or reducing consumption may require professional support. One strategy to consider is switching between periods of abstinence and controlled drinking to gradually reduce the urge for alcohol over time.
Tip number 12. Quitting smoking.
Smoking damages the walls of your blood vessels, leading to plaque buildup in the damaged areas and atherosclerosis. This plaque narrows the blood vessels, raises the heart rate, and puts additional strain on your cardiovascular system. Smoking also harms your lungs, reducing the amount of oxygen absorbed by the body. This results in low oxygen levels in the blood, reducing the working and repairing capabilities of your cells, including those in your heart and arteries. To successfully quit smoking, professional support is highly recommended. You can also try nicotine replacements, such as gums and oral sprays. Before we conclude today, I want to leave you with a powerful reminder. Your health is your most precious asset. By implementing these 12 natural tips, you're taking a significant step toward a brighter and healthier future. I have a favor to ask of you. If you found this video informative and valuable, please don't keep it to yourself. Share it with your friends, family, and anyone who might benefit from this knowledge. Together, we can spread awareness and make a positive impact on people's lives. Thank you for joining me today on this journey to better health. Until next time, stay healthy, stay informed, and let's make positive changes together. Subscribe, like, and share. Your actions can help transform lives.